Hi Mia, how are you?
Good.
Before we start, we want to analyze your face for asymmetry. If both sides the same or both sides looks a little bit larger than the other, we can analyze it. And then we also analyze your facial aesthetics, a three-way, which is the macro aesthetic, which is basically your face, your head, and your proportions. The medium aesthetic, which is your teeth and the smile, and then the micro, which is the teeth itself. We're gonna analyze three things, and then we're gonna tell you what we can do and what we can't do, and then you have an understanding of your facial features as well, and then we know how we can improve you. Is that okay?
Okay.
Okay, thank you. Without further ado, I'd like to blow up some slide on the screen so we can analyze it together.
Okay.
So now we have your photo on the screen, your extraoral photo, and also the intraoral photo on the screen, and also all your x-ray, and we're gonna analyze it with you together. It's okay? So I'm gonna turn off the light right now. Okay, yeah, let's have a look of your face. Now this is an image of you taken with a stone face. Let's see if your face is symmetrical. We bisect your face. See that? Your face is pretty symmetrical. Except if you notice on the right side, this mandibular angle, this called soft tissue gonial angle, is take on a more acute angle. On the left side is more obtuse angle. This is only different. Then of course you draw your eyebrow a little bit higher on the left side than on the right side, which is a minor difference. You may notice it now, then next time you can draw it whichever way that looks good on you. Okay, next. Now this is a vertical proportion. Your face is ideal. Your forehead may be a little bit short, but overall it's okay. Your forehead and your mid face and your lower face, they are in perfect proportion, which is 1 to 1 to 1. Next. Okay, let's look at the transverse proportion. Transverse proportion, we use the width of your eye to measure. From the outer helix of the ear to the outer canvas of the eyes is one width of the eye. And then you have the eye, and then between the eye is one eye between the eyes, and then there lies between the width of the nose, which is good, and then the lip should be around the pupil of the eyes, which in your case is almost perfect. So I think you have perfect facial proportion in a transverse direction, also in a vertical direction. Your proportion is perfect. Next. Okay, this is a different photo. This one I capture when I say I want you to pretend to be very happy. See, look, this is when you really shine, because you can see you got a beautiful face, you got a happy face. The only thing let you down is the arrangement of teeth, which is what we're good at. We're gonna align these teeth properly. But I think your teeth at the moment is a little bit gummy, but it's acceptable. What we can do is when we do the liner, we may intrude a little bit of the upper teeth to minimize the gummy smile a little bit, just a little bit. But that can be controlled by either not lifting your lip while smiling. It's only very minimal. It's not something that really serious. Okay, next. Okay, this is measurement of the face, whether you have a straight profile, a convex profile, or a concave profile. Now I'm using this measurement for Caucasian because they usually measure from the bridge of the nose to the to the base of the lip, upper lip, and then from the upper lip to the chin. Now, if you measure like this, of course you have a convex profile, but because you're an Asian girl, you're beautiful, and you don't have much of the bridge of the nose. So for me, I would measure from the forehead like this. From the forehead, then this shows you really do have a straight face. Okay, next. Now this is the aesthetic E line, and then all your lip line behind the E line, which is correct for Asian. Next, but when you smile, you can see your lower jaw kind of extenuate. Your lower jaw appear more prolonged when you smile, and then that's really good. So now it's in perfect proportion. The upper lip is 4 mm to the aesthetic line, and the lower lip is 2 mm to the aesthetic line. So you also look a lot better when you smile. Next, see, this is a stunning contrast for a stone face you and for a smiley you. You can see when you smile, you really shine. So don't forget to smile, and always smile. And then you see your facial proportion is almost perfect, and then you have a good looking face, and your facial feature bring out more when you smile, whereas when you have stone face is just not good. The curvature of the face, the cheek is just not good. The cheek and then the chin, the curvature of the cheek bring out when you smile. Next. See, this is another picture. It shows you a stone face you and a smiley you. You can see the curvature. What about the teeth? Yeah, okay, you have a crossbite. We'll look at the teeth. Next. Now this is the teeth. The first one you notice is the midline. The upper dental midline is a little bit to the right. That's because of the crossbite. When we fix up this lateral crossbite, then we can shift the midline to the middle. And what about the gingival level? The gingival margin is just about correct, because that is almost the same level as the canine, and the lateral incisor is about half to 1 millimeter lower than the central incisor, which is correct. And then also the zenith of the central incisor is a little bit distal to the axis of the upper central incisor, so which is good. And then all the teeth are in golden proportion. What do you mean golden proportion? Golden proportion is 1 to 1.618. The lateral incisor should be 62% of the central incisor. In your case, it's roughly 62% to the central incisor, and the canine is about 62% to the lateral incisor, which is exactly ideal golden proportion. And then in the lower teeth, you can see you have some gingival recession. You have a very thin gingival bow type. That means we cannot move the teeth in and out too much. Particularly, we cannot push the teeth out too much because of the gum is a very thin bow type. We have to teach you how to brush properly so you to prevent further recession on your lower teeth. In fact, we're gonna bring the lower teeth inward a little bit because you are slightly class 3 dental situation, which is the lower jaw is slightly more forward than the upper jaw. Next, I taken this photo where you have your teeth slightly apart. You can see the crowdedness of the lower teeth. Yeah, we can fix that. We can make the teeth straight. Next, and this is the right side. You can see the crossbite. You can see the molar relationship is slightly class 3, as I predicted, when I look at your face, is slightly class 3, which we can fix. It's only a little bit class 3. Okay, next. Now this is the left side. The left side, you have a missing first molar. Don't worry, we will do something about it. What I'm planning to do is to distalize this second molar so that you have proper size first molar. How do we replace it? We're going to put an implant. We're going to put a proper size first molar in this region here as an implant, as a dental implant, to replace your missing teeth. Notice this side, you are class 1 situation, but slightly class 2 in canine area. Why? Because you're missing a first molar. The second bicuspid, and then the first bicuspid, and then the canine will drift distally as you're missing these two, because nothing stops this teeth from going backward. This is a natural phenomenon. Therefore, you can see the canine is not in the ideal class 1 situation. It's a little bit class 2 because of the falling back of the first bicuspid and then the second bicuspid. And also you can see the second molar drifted mesially as well. Next. Okay, this is the upper arch photo. You can see you have a nice arch, wide arch. Therefore, when you smile, you have a beautiful smile. The only thing is you have this crossbar that we can fix. When we fix up this crossbar, you can see the middle, this vertebrae, this median vertebrae will be pushed back in the middle. Okay, next. See, this is what I said. See here, on the left side, you have a missing molar. What's happening? These two here, the second molar, drift backward. The first premolar drift backward. The cuspid drift backward. All this is drift backward. So you can see this side will appear slightly class 2. And also the molar 2 drift mesially. This drift distally. The second bicuspid. Okay, next. Now this is X-ray of your face. You can see your lower jaw is slightly larger, only slightly, still acceptable. You have a very steep mandibular pain angle. That's okay. Overall, it looks good. Okay, next. Now this is how good you are. The only thing is we have to fix up the teeth. Maybe we make your teeth not as gummy when we finish. And we will do a very nice smile arch for you, which will be mirrored to your lower lip. This is called smile arc. We will produce a very smile arc. We probably will minimize some gummy smile as well by a little bit of intrusion. Next. Okay, so you can see it's quite chaotic since you lost the molar. By the way, all your third molar, wisdom tooth, didn't seem to have enough room. They may need to come out in due course. Not now, in due course. Now we moving teeth, but except the lower left third molar, maybe we have to extract this too, so that we can distalize this second molar to make room for the implant here. Okay, we're gonna put an implant here. You'll be very happy because we're fixing teeth straightening and providing an implant and giving you perfect occlusion on the left side. At the moment you tend to bite on the right side more, but when we finish, you have the ability to bite on your left side as well. So you will eat on both sides. And also a lot of some other dental problem, you didn't have a properly done root canal therapy. You didn't have a properly done root filter too. We will fix it up later on. And also the top, maybe you need some root canal therapy. The upper right first molar and the post, etc., etc. We will arrange it for you. So that's about conclude for today. And the limitation of your treatment is not much, because you are quite beautiful, quite symmetrical. We not only be able to achieve a perfect smile, we can enhance your beauty by that perfect smile. Okay, Mia, so you understand your situation?
Yes.
So that's about conclude what we had to do today. Today is we have to make you understand your situation. For example, you have a missing tooth there, which you will require an implant later on, and also you understand your face is not 100% symmetrical, but it doesn't matter. But there's something that we can do. At the end of the day, we will want to make your teeth as beauty as Invisalign possible to do it.
Okay.
Okay, if you have any question?
No.
Okay, thank you very much.
Thank
Next
you.
week, I will have your clean check for you to have a look how we move the teeth. Thank you for coming.
Thank you.